In this video, I'm going to do a quick overview on our different notebooks that we have. These are our core set of notebooks. If you're in medical school, if you're an intern or a resident, whatever it may be, this is going to be the core set of notebooks that you may use on your different rotations. And so we have very different videos and going into the specifics of all these different notebooks and kind of comparing and contrasting them. So I'm not going to do that here. What I really want to do is talk about big picture, what each of these may be used for, some things that are going to be more obvious and some things that are going to be more different. So obviously the notebooks that are going to be pretty obvious and what they're going to be used for is going to be our neurology, surgery, OBGYN, and pediatrics notebooks. Those are going to be really catered towards the specific rotation that you're on, whether or not you're on neurology, surgery, OBGYN, or pediatrics. So these four should make kind of grossly should make sense to you what they're used for. The ICU notebook is a little bit different. And the main reason why it's different is going into detail in regards to your progress notebook. So when you look at an ICU patient or when you present an ICU patient, it's going to look very different from other situations because it's going to be system-based rather than going by general problems. So it's going to be broken down to neurology, CV, poem, things like that. So it's going to be presented in a very different manner. So that's why ICU notebook or an ICU template in general, how you write a note, it's going to be very different from any of the other ones. So that's going to be our ICU notebook and what situation you may be using for that. Really any situation where you are looking at a patient in a more systematic basis. So it doesn't necessarily have to be in the ICU. It can be in, step down units that present patients in a way that's more organ based. So that's a situation where you might want to use that. Or it could even be when you're on your cardiology rotation and you're dealing with ICU type patients. So that's going to be our core 5 notebooks that are going to make quite a bit of sense in my opinion of when you may want to use them and when you may want to use something else. These 2 notebooks, our standard H&P notebook and our progress notebook, may need a little bit more explaining. So our H&P notebook, very standard, is just going to be a typical H&P template where it's going to be catered really for outpatients. So it can be either outpatients in the ED, somewhere where you're just seeing a patient one time and you're not going to be following them day to day, right? Because each individual page is going to be a 2-page template. It's going to be repeating multiple times. So this is just going to be in the setting of you want to see a patient one time and you're not going to see them again after that. Or if you do, the next time it's going to be on a whole new encounter. Our progress notebook is going to look a little different. And the reason why it's different, the first 2 pages are the same. But then going on forward, you're going to be seeing that this is going to look more like a SOAP note format. So it's going to be the same patient that you're going to follow for a few days, whether it be 1 day or up to 4 days. If you do more days, you can just use the same template, just on a different page. But this will give you kind of a follow-up in terms of if you're looking at an inpatient, this is going to be the situation that you want. So on inpatient medicine rotations, you could technically use it for inpatient whatever, surgery, OB-GYN, pediatrics. It can all be used for that, but really the main difference from this versus the other ones is going to have a SOAP note template that accompanies it. So that's going to be the major differences between all of our different notebooks. Similarly, our surgery notebook is going to be the other notebook that's going to have a SOAP note component. So a surgery notebook, we'll see if we see on day 1, it's going to be our standard H&P template, catered more towards a surgical patient. But then when we go to our next page, it's going to look kind of like this white notebook right here, our progress notebook, where you're going to have multiple day SOAP notes. So this is also going to be an inpatient setting, as typically your surgical patients that you're going to be dealing with them on an inpatient basis. So hopefully that gives you a good understanding of the different notebooks that we have and which situations they might be useful in one way or the other. We have a notebook that will help you in every single situation.
Be sure to check out our website, medicalbasics.com, for more educational resources like our medical ID card, scrub notes, and don't forget to subscribe to our channel for more tips and lessons.